For Body Chemistry Associates and Health Connection Radio, I'm your host, Jay Foster. Today I want to talk about breast cancer prevention. This is Breast Cancer Awareness Month. I think there should be a Breast Cancer Prevention Awareness Month and a Cancer Prevention Awareness Month. This is not saying don't get traditional therapy or testing or anything like that, but there are an abundance of scientific studies that point that diet and certain nutrients actually have had a positive influence on preventing breast cancer. I'm going to read you some of those. You know, the American Heart Association and almost everybody says go on a low-fat diet. Well, a low-fat diet is by definition a higher carbohydrate diet, and sugars and carbohydrates raise insulin. So what's the problem with that? Well, in the British Medical Journal, way back in the year 2000, the summary of the study said about correlating high insulin levels with breast cancer death. The researchers found, and they had two groups of women, both had a history of breast cancer, okay? One group had low insulin levels and one group had high insulin levels. They found the women with a history of breast cancer having the highest insulin levels were not 20% more likely to die during the study, not 50%, not even 100%. They were 800% more likely to die during the study than the women with the lowest insulin levels. British Medical Journal in the year 2000, they also said, moreover, with the high insulin, those with the high insulin levels were at least 400% or 4 times more likely to suffer metastasis, metastatic disease, and disease recurrence. So we think for breast cancer prevention, you need to be on a no-sugar, probably a very low carbohydrate diet, and increase good healthy protein and good healthy fats. Now, the bad fats are basically margarine and corn oil and polyunsaturated vegetable oils. Very, very bad. The good fats are everything else. Fat is not bad. It's not bad for the heart. It's not bad for it's good for the brain, and it's probably good to protect against breast cancer because it helps to stabilize insulin. So fish fat, tuna, swordfish do not contain the type of mercury that we absorb. It is mercury selenide, no problem there. Tuna has a lot of good beneficial fat. Salmon, get not farm raised as possible, get ocean salmon, Pacific salmon is very nourishing, has all the good essential fatty acids to block inflammation, which is always has a role with certain types of cancer, including breast cancer. So by avoiding refined sugar, reducing carbohydrates, especially processed carbs, and increasing fats, like to cook in, the 3 best oils to cook in from some of the experts: butter, coconut oil, the white coconut oil, and lard. What did your great-grandparents cook in? They cooked in lard. So it's never been a problem. It's not the fat that's been the problem. It's the sugar that's been the problem in both heart disease and certain types of cancers. So that was a very good study, and there are others from the British Medical Journal linking high insulin levels with breast cancer deaths. Well, what about vitamin C? Vitamin C, there's a lot of different studies on vitamin C. What did I just do? I just made a noise. On vitamin C, way back in 1990, in the Journal of the, guess what, National Cancer Institute, they actually wrote this. In a review of data from 12 case-controlled studies, about 25% of postmenopausal breast cancers could be prevented with diet. In reviewing data from around the world, vitamin C reduced cancer risk in postmenopausal women. Increasing vitamin C intake to at least 380 milligrams per day would lower breast cancer rates in the U.S. alone by 16%. We recommend 1,000. We recommend 3 times that. Some people I recommend 5,000, 10,000. As long as it's ascorbate and the tests show they need it, there's no downside to taking more. If you hit loose bowels from it, then you cut it back. That's the only side effect. It doesn't cause kidney stones. So this was combined analysis, dietary factors and risk of breast cancer, combined analysis of 12 case-controlled studies published in the Journal of the National Cancer Institute in 1990. Now, had you gone to PubMed today, as I did, and looked up vitamin C and breast cancer, you would have found 447 studies. How many of those has your oncologist read? I bet very few, except maybe one negative study. The rest are very positive. One of the positive studies in here is that vitamin C, this is in Science Reports in March of 2018, vitamin C promotes apoptosis in breast cancer cells by increasing TRAIL expression. So the apoptosis is programmed cell death. Instead of the cancers living and replicating and continuing on and growing and getting worse and worse, vitamin C helps to induce apoptosis, programmed cell death, to kill the cancer cells. And again, I'm not saying do this in place of any traditional therapy you choose to take, but there's no problem with taking vitamins and chemo. Dr. Ralph Moss wrote several books, and one of them was Questioning Chemotherapy, another one was Antioxidants in Cancer Therapy, and he did all the research from around the world saying that antioxidants in supplements do not cause a problem in blocking the positive effects of chemo or radiation, but they do protect healthy cells from the side effects. So, vitamin C, this is out of March of 2018, helping to kill the breast cancer cells. So vitamin C you can take almost as much as you want, as long as it's ascorbate and not ascorbic acid. It should be taken with food. If you're not taking any, we recommend a minimum of, I used to say 1,000, now I say 2,000 milligrams per day for adults. Some people we recommend 4,000 or 5,000 milligrams a day. Some people we recommend 8,000 to 10,000 milligrams a day. And some people we recommend they go get IV vitamin C at a local spa here. So there are, it's science-backed. Pauling did a lot of studies on with you and Cameron on vitamin C and cancer therapies, and certainly in Breast Cancer Awareness Month, we should know about that. Also, increasing fish oils for the good, healthy fats. And Stephen Sinatra, the cardiologist, did a lot of research on coenzyme Q10. He says that coenzyme Q10 can help prevent, again, prevention, can help prevent breast cancer deaths. He said in humans, anecdotal reports at that time, and this was written way back when, high dose of CoQ10 supplementation, which would be like 4 of our Super Q gel or about 400 milligrams a day, has been associated with complete remission even for patients with metastatic breast cancer. It was only 3 people in this one report, so it's not like they studied 1,000 people. But they were noted with increased CoQ10 and remission and reduction in certain cancers, especially breast cancer. Statin drugs, Lipitor, Crestor, or any of the simvastatin, atorvastatin, deplete CoQ10 and therefore increase the risk not only of type 2 diabetes, but also of breast cancer and other cancers because they deplete CoQ10. So anybody, first of all, any doctor that prescribes a statin drug, if they know what they're doing, they will prescribe CoQ10 with it. If they don't know what they're doing, they won't say a word about CoQ10. And that's dangerous because that means they don't know how the drug works and what the possible side effects are. So the bottom line is there are nutrients that you can take to help boost your system and boost your immune system, antioxidants in general, vitamin E, vitamin C, CoQ10, fish oils help a great deal, lots of vitamin C, and avoiding refined sugar. More information on our programs, Body Chemistry Associates, since 1982, providing natural solutions for your health concerns. Give us a call at 1-800-CHEMIST, 1-800-243-6478. On the web, 1-800-CHEMIST.com. biochemistryassociates.com. Jay Foster for Body Chemistry Associates and Health Connection Radio, back soon on a new blog.